Welcome to the Other Side of the Firewall podcast, where we talk about the latest and greatest in cybersecurity news, as well as we highlight those movers and shakers and glass ceiling breakers, those people of color who made it to the other side of the proverbial firewall. My name is Ryan Williams, and as always, I'm joined by Shannon Tynes.
What's up? What's up?
What's going on? And Chris Abacon.
What's going on, everybody?
What's going on, Chris? So Chris is back from vacation. So hopefully in the next couple of weeks or so, we'll have everybody on the team in one episode for the first time. So definitely continue to check us out for that. Monday and Tuesday are topics. Wednesday, discussion. Thursdays, ask CISSP. Please check out last week where I had on Elizabeth Stevens. So she's a living legend, right? A retired Marine who's done first in many regards. She was a helicopter pilot, one of the first to fly the V-22 and so much more. So she now has a cybersecurity company called DBS Cyber, and it is doing incredible things as well. So check out that episode if you have not already. It's supposed to be 45 minutes. We went for an hour and a half because she just had so much, like so many stories, so much rich experience. It was a great conversation. And then hit up all the websites to go by our name, The Other Side of the Firewall, The Other Side of the FW, or ask a CISSP. But without further ado, I give it to Shannon.
All right, everybody. So this next article comes from usatoday.com, right? And so written by Kristen Jordan Seamus and Mina Rashad. And as DJ Khaled would say, you know, hey, another one, right? Another one. So hospitals across U.S. disrupted after cyber attack targets healthcare titan Ascension, right? So it's a little bit different in that it wasn't like the what do you call it? I don't want to call it the billing company. What was the other one? They weren't the
insurance company, right?
Well, was it the insurance company or like the ones that handle?
They did billing, like claims and things of that nature. They did that.
Yeah.
I'm trying to figure the term for it, but it'll come back to me later. But like, this is a little bit different, right? Because this was the actual hospitals that's actually being hit, right? So when it's in the Ascension Network got hit, and this is cyber attacks, man. Like we can't talk enough about how you need to protect against them, and this is the reason why, right? So in this instance, and we've had stories about this before in the past, right, where you start losing services and whatnot in your hospitals, and then you can run into instances where people actually die, right? Like things that are needed, whether people are going through operations or different type of medical care to get them what they need. You're not actually able to do that. But this Ascension, the St. Louis-based health system has 40 hospitals across the United States, right? And said it detected an attack. This was last Wednesday on the clinical operations, and the clinical operations continue to be impacted, right? So they had to sever their connections to their online systems, right? So it's grab the big axe and cut the hard line, right? We talked about this before, right? That's what they out here doing virtually, right? But this was May 8th that they detected the unusual activity, right? And so they believe it's a cyber incident that's behind it, but they got a little bit ahead of the curve, right? So they kind of went and started shutting things down. But whenever this happens, right, you got to start doing things that you don't normally do, right? You start going the pen and paper, right? Pen and pencil and paper route. Man, I can't speak today. I don't know what the deal is. But that's what they're having to do for their network, right? They have a part in here where they're talking about healthcare workers in a Wisconsin sites not having access to Epic, and I know Epic is one of those things that leaders use, like when it comes to putting prescriptions into a system, sending prescriptions out to pharmacies, things of that nature, right? And it also stores patient medical information, right, and for management of their care. So they lost access to that, and so they got people like to different places across the hospital, like to do different things, right? They're calling, they're doing things like calling and giving results over the phone when it comes to like X-rays, because they can't send them throughout the departments like they need to. So and this is why people need to take cyber more serious, right? Because you have things like this that happen, right? And this is a crisis situation for them, right? And this is actually a nurse that's quoted from them, right? A registered nurse that said it is a crisis situation, right? because again, everything we do to make things more efficient and to make things go faster, it's done through computers. So when you lose that capability, the fact that, and here's the thing, in the medical arena, they are already short staffed, right? They don't have enough doctors, enough nurses, right? So now when you have it to where it's not easy for them to just hit a button and ship something off somewhere, and they may have to run or sit down at a telephone and talk to somebody on the phone and give a long drawn out, hey, this is what's going on. It's less care that can be given to people that actually need it, right? But that's what Ascension is dealing with because of this. And this is why things need to be taken more serious. And again, with this, the second and third order effects of this, right? After all this information gets out there, what's going to end up happening? You're going to have your phishing emails. You're going to have, different patient information that can be out there for blackmail, things of that nature, right? Because with 140 hospitals across the state, who's to say you don't have powerful people that go to these, right? Maybe even politicians, right? So we talked about this before. And information is leaked like that on what it could be used for. And here we are again, right? So, like I said in the beginning, right? Another one, right? and there will come a time where will be another one, and another one, and another one. I'm not naive enough to believe that this won't stop in the near future, right? Because they are soft targets, and it's proving profitable, right? We talked about how profitable it can be when it comes to medical information as well, right? So, this is what they're dealing with again. Another one for Ascension getting hit this time. But Chris, what's your thoughts on this?
My first thoughts were initially training, right? Again, I think I've said it in one of the first podcasts I was part of, but the human element can't be underestimated in this respect, right? Because, I read the Horizon breach report, and they sent out a Horizon security services sent out a breach report every year. So the 2024 statistics, specifically number one, right? 68% of breaches involve a human element. I mean, when that is a huge number, that can probably account for, there's a high probability that the human element will take part in this specific breach, right? And then here the note that says 32% of breaches involve ransomware or extortion, and 28% involve, right? And then only 15% of breaches involve a third party, including the third software viruses. So I mean, you're talking 68%. And 32%. Again, they're some different data sets. You're pretty much talking nearly every one of these events involves the type of ransomware, extortion, and then the human element. Because that's how they get you. And recently some of these phishing emails have gotten so good, even on my personal email. I'm like, wait, is this actually a chase email? No, because I know that, I mean, just because we've done this our entire career, you do look for things like, hey, where's this email from? Chase had two E's in it. Phishing, right? This .com with two M with two O's or something weird, if you're looking at a URL from a different country that, it's probably phishing. Let's get real here.
Like .ru, no.
.ru, absolutely not. These fishermen need to start starving. No, we can't feed them. We gotta stop feeding these fishermen. But yeah, the human element, right? Like the click. Yeah, I think this is a huge problem within. I think I've also discussed in the past how the nature of healthcare is to be, caring, trusting, to take care of the patients, right? But that mindset, that level of care, where you trust first, kind of, you can't do that in the healthcare industry. You the whole trust and verify thing, trust no one, verify everything. You got to go with that mindset, especially in society within the healthcare industry. Maybe adopting zero trust as a policy throughout the enterprise, right? Not, zero trust is a state of mind, right? Like trust nothing. And that's maybe that's how the healthcare industry can start improving, and hopefully we see less and less of this news. But again, like we were talking about previous podcasts, there's a lot of money that the healthcare industry makes a ton of money. Where are they going to invest that into? They're going to say, hey, no, we're going to look into drugs. We're going to look into services. We're going to look into research. They're looking for the next lucrative thing. But the healthcare industry does not take this seriously, they are taking it seriously. They don't want to invest in it, and there's money really locked in. It's just going to keep happening, and it's going to be DJ Khaled with a new song every month.
No, exactly. Please like, share, subscribe. I have no good segue from that one. DJ Khaled. We need to at some point hit 1,000 subscribers in order to do more with the channel. So next milestone is 500. So please continue to share it with your friends, to like, engage, and all that good stuff, because that gets us to pop up in people's feeds. And just continue to keep doing what you're doing, because we're getting closer to 400. But I'd like to hit 5 by June, 1,000 by the end of the year. So definitely continue to hit up all the websites to go by our name, or hit us up personally. Well, not Shannon, unless you know his address.
And
His
don't just
footprint is
show up. I'm
small.
just telling you, don't just show up.
But no, I think you guys really hit the nail on the head. I don't really have much more to add to it. It is another one we talked about these in the past, how detrimental it could be to people, because they have second and third order effects. And then just to elaborate on a piece that Shannon brought up, like they are stressed. There's not enough of these clinicians to do this work. And another order of effect may be that they leave, right? Like COVID, we shed a lot of clinicians during that period because they're overworked, underpaid. So now you add the element to, like, if this becomes the norm, and now they're sending carrier pigeons between different departments in order to make sure people get their treatment or whatever, they might just find another career path. They're like, this is too much. Like, I didn't sign up for this. So it is definitely detrimental. But I think it really comes down to your biggest attack surface are your people. And that's not it's not a slight at the individuals. It's where you should put your money at. Like, when it comes to your different controls, restrictions, things of that nature, you have to beef it up. You have to stop people. You have to stop it before it gets to the people. And then when it comes to the things that slip through the cracks, are they aware? You have to make them aware of how these things work. It has to be in tandem. Like, these two things have to work together, because that's how they're getting into these systems. They're getting it through phishing. They're getting it through links. They're getting it through social networking. Like, how many times has it, like, what was it? In Vegas, it's a phone call, right? They pretend to be the help desk. So people are your biggest attack surface. So you have to mitigate that as best as you can. If they're just not doing a really good job in the healthcare field right now, in doing that, their focus should be on patient care and R&D and things of that nature. Of course, that should be paramount. However, you can't do any of that if you don't have the ability to log into your systems to make it happen. So again, biggest attack surface, people. So figure out a better way of doing that, and I think that a lot of this will go away. And that's a very general statement. I'm sure somebody just punched the radio, but it's the truth. Like, how are we preparing people for all of this that's currently happening, and then the future of how AI will ratchet it up and make it even more diabolical? So I don't know. But continue to tune in. Hopefully next week there will be no hospital breaches and or mortgages or insurers or any of the above that's been happening. State, local governments being attacked.
Gas pipelines.
None of that. Just quiet.
Operational technology.
Yeah. So hit up all the websites that go by our names, either the other side of the firewall, the other side of the FW, or Ask a CISSP. Tune in to last Thursday's episode if you have not already, with Elizabeth Stevens, definitely living legend, who transitioned from being a pioneer in the Marines to a pioneer at Microsoft, and now a trailblazer and pioneer in the cyber sector at DBS Cyber. And then Friday's everything else: movies, books, games, all that good stuff. So hit up all the websites that go by our name. Give me a person at RyRy Security Guy. That's RYRY Security Guy. You can find me on LinkedIn, Clubhouse, Twitter, IG, TikTok, and Medium. And you, Chris?
You can find me on LinkedIn under Chris Avicon.
There it is. Stay safe. Stay secure.